Many people believe that death, particularly in older age, occurs suddenly, catching everyone by surprise. However, in reality, the body often signals its final stages well in advance, sometimes months, even a year before the end. The problem, though, is that these signs are subtle, and most people dismiss them as simply part of getting older. It's only when we look back, often after the fact, that families realize these signs were present all along. Unfortunately, by then, it's too late to take proactive steps, too late to make meaningful memories, and too late to truly prepare for what's ahead. In this video, we'll explore 5 critical signs that may appear months, even a year, before an elderly person's passing. Some of these might be things you've noticed but chalked up to natural aging, while others might seem like minor changes but are actually signals of the body's gradual decline. Recognizing these signs early gives you the opportunity to provide better care. Cherish the meaningful moments and, most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs will help you prepare emotionally and practically for what's ahead. When you understand what's happening, you won't be caught off guard. You'll be able to make the most of the time you have left with those you love.
1.
Significant weight loss. One of the most striking and often worrying signs that someone is approaching the final stages of life is unintentional weight loss. While gradual weight loss can sometimes be attributed to the natural aging process, a significant and noticeable decrease in weight, especially when it is not intentional, can be a troubling indicator. This process typically starts subtly. Perhaps a belt that once fit comfortably now needs to be tightened, clothes feel looser, or there's a gradual but persistent decrease in appetite that might seem minor at first. In many cases, families and caregivers may dismiss this change as part of aging. But it's important to recognize that significant, unexplained weight loss is rarely a positive sign and often warrants further attention. As individuals approach the final stages of their life, the body begins to undergo a series of complex physiological changes. One of the most noticeable is a decline in the body's ability to absorb nutrients. The digestive system starts to slow down, which can impair the absorption of essential nutrients and lead to nutrient deficiencies. This becomes increasingly apparent as muscle mass begins to decrease, even in the absence of exercise or physical activity. While some loss of muscle mass or sarcopenia is a natural part of aging, a significant or rapid decline in muscle tissue is a cause for concern. The muscles in the body are not only responsible for physical strength, but also play a critical role in maintaining metabolism, stability, and overall body function. When muscle mass deteriorates, it can lead to diminished strength, which, in turn, makes movement more difficult and increases the risk of falls, particularly in the elderly. This loss of muscle also weakens the immune system, rendering the body less capable of fighting off infections or illnesses. One of the key factors contributing to weight loss in the elderly is a change in appetite. As the body prepares for the end stages of life, appetite often declines significantly. This can be due to a variety of reasons: the loss of taste buds, reduced sense of smell, or simply a diminished interest in food. Eating may no longer bring pleasure, and food might lose its appeal. As a result, older adults might skip meals, eat less frequently, or consume only small portions. This isn't just a personal preference, it's often a physiological shift that accompanies the body's natural aging process. The reduced desire to eat can also be a sign that the body is starting to shut down. The gastrointestinal system may no longer function efficiently, making it more difficult to digest food properly. As a result, the elderly may experience difficulty processing even basic nutrients, such as protein, which can lead to muscle wasting. This results in a cycle where the body, deprived of essential nourishment, begins to function even less efficiently. It's crucial to understand that, at this stage, it may not always be possible to restore the appetite or prevent the weight loss, as the body is signaling that it is preparing for the inevitable. In many cases, the weight loss is compounded by underlying medical conditions that can further accelerate the decline in health. Chronic illnesses such as cancer, heart failure, kidney disease, and liver disease often progress slowly over time, with weight loss being one of the first noticeable signs. These conditions place a considerable strain on the body's ability to function normally. For example, cancer can cause unintentional weight loss due to both the disease itself and the treatments, which may reduce appetite and alter metabolism. Depression and cognitive decline are also significant contributors to weight loss in the elderly. Individuals suffering from depression may experience a lack of interest in food or a decrease in their ability to recognize the need to eat. Similarly, cognitive impairments such as dementia can lead to confusion about meals, poor appetite, or forgetting to eat altogether. When these conditions are present, weight loss often becomes part of a larger, more complex picture of decline. While many people instinctively try to counteract weight loss by offering favorite foods or supplementing meals with high-protein drinks, it's important to recognize that in the later stages of life, diet alone is unlikely to resolve the issue. If weight loss persists despite these efforts, it may be time to consider the fact that the issue is no longer just about food intake, but about the body's inability to process nutrients effectively. At this stage, it may be more important to focus on providing comfort and ensuring that the person remains hydrated, rather than forcing larger meals that may be difficult for them to consume. Providing foods that are easy to eat, such as soups, smoothies, or small, manageable snacks, can help provide some nourishment without overwhelming the person. It is also crucial to offer emotional support, as the physical changes can often be accompanied by emotional and psychological distress. Spending time with the person, offering gentle encouragement, and focusing on quality of life rather than strictly on nutrition can provide significant comfort. Understanding that unintentional weight loss in the elderly is a multifaceted issue, rooted in both physical and psychological changes, is key to approaching this difficult time with compassion. Recognizing that the body is signaling that it is no longer able to function as it once did can be challenging, but it is important to address these changes with clarity and empathy. Offering emotional support, ensuring hydration, and providing comfort foods are ways to navigate this period with the utmost respect for the person's dignity and well-being. Recognizing the limitations of intervention and accepting the natural course of aging can help families and caregivers approach the situation with the care and love that is needed in such sensitive moments. 2. Extreme fatigue and weakness. One of the most profound and unmistakable signs leading up to the end of life is persistent and overwhelming fatigue that doesn't improve with rest. This fatigue is not just a passing tiredness after a long day or a momentary lapse in energy, but rather an all-consuming exhaustion that settles into the very core of the body. It is the type of fatigue that persists for days, weeks, or even months, and no amount of rest seems to offer relief. The difference between ordinary tiredness and this kind of profound weariness is striking and undeniable. It is an exhausting force that makes even the simplest tasks, things once taken for granted, feel insurmountable. For many elderly individuals in the final stages of life, even the smallest movements become a monumental effort. The simple act of rising from bed becomes an exhausting struggle, each movement requiring more energy than it seems to provide. Activities like walking across a room, preparing a meal, dressing, or even holding a conversation can become too taxing. What was once second nature, flipping a switch, taking a few steps, making a cup of tea, becomes an exhausting ordeal that requires significant effort. These actions, previously routine, may take much longer to complete or may be abandoned altogether. This kind of fatigue isn't simply a normal part of aging, it's a distinct and telling sign that the body is entering its final phase. The weariness that overcomes the body is a result of a combination of physiological processes. As the body's systems begin to slow down, the energy that would typically be used for daily tasks is redirected towards preserving vital functions. At this stage, the heart no longer pumps as effectively, circulation weakens, and oxygen-rich blood no longer flows to muscles and organs with the same efficiency it once did. Muscles begin to lose their tone and strength due to the lack of oxygen and nutrients, leading to a weakened, unsteady body that struggles to maintain physical function. Many elderly individuals, especially in the final months or year of life, feel an overwhelming sense of frailty. This is a time when mobility is reduced, and actions that were once taken for granted may no longer be possible without significant assistance. A key component contributing to this extreme fatigue is metabolic slowdown. As the body nears its end, the metabolic rate declines sharply. The body's ability to produce energy diminishes, and instead of using energy for physical activity, it turns inward, focusing on preserving core functions necessary for survival. This often results in more hours spent sleeping or resting, and an increased frequency of naps. Energy levels fluctuate wildly, with moments of extreme fatigue that come on suddenly, leaving the person feeling drained and depleted without any clear reason for their sudden drop in vitality. Emotionally, this fatigue can be just as challenging. For many seniors who once prided themselves on their independence, the onset of extreme fatigue can be a source of profound frustration. It's difficult to come to terms with the reality that once simple tasks have become insurmountable. There's often a sense of embarrassment or shame that accompanies this loss of ability. The individual may feel embarrassed about needing help with everyday tasks, especially when they once prided themselves on being self-sufficient. This shift in capabilities can create a sense of vulnerability and may lead to withdrawal from social interactions. The individual may feel reluctant to engage with others, fearing that they will be judged or that they will inconvenience others by needing assistance. Hobbies and activities that once brought joy may lose their appeal, or they may simply become too physically taxing to attempt. The person may choose to isolate themselves emotionally, retreating from conversations and the social world they once actively engaged with. It's important to remember, however, that this is not a sign of laziness or a lack of desire to engage. It is a result of the body's diminishing capacity to function. The energy is no longer available, and what remains is a body that is simply too weary to continue. While it may be difficult for family members to witness their loved ones decline, it is vital to approach these moments with compassion and understanding. The temptation to urge the person to snap out of it or to try harder is natural, but it often overlooks the reality of the situation. Pushing an individual beyond their physical limits can cause additional stress and frustration. The best way to support a loved one who is experiencing extreme fatigue is by meeting them where they are, both physically and emotionally. Recognize that rest is crucial, and allow them the time they need to conserve their remaining energy. At this stage, what matters most is not what the person can still do, but the way in which they feel supported, cherished, and understood. Create an environment that is peaceful and comforting, where the person can rest, find solace, and feel safe. While it is natural for families to want their loved ones to engage or remain active, it is equally important to allow them to take the time to rest without guilt or pressure. These moments of rest are not just a necessity for physical well-being, but also an essential part of the emotional journey that both the individual and their family must navigate together. In these tender moments, it is essential to emphasize emotional care. Small gestures of love and comfort can make all the difference. The focus should shift from physical activity to emotional connection, providing moments of calm and reassurance. Offering a hand to hold, speaking softly, and sharing memories can provide much-needed emotional sustenance. What matters most during this time is not the level of activity, but the person's sense of being loved, understood, and valued. The goal should always be to create an atmosphere of acceptance, ensuring that they feel as comfortable and cared for as possible, regardless of their physical limitations. 3. Cognitive confusion and withdrawal. As individuals near the end of their lives, cognitive functions often begin to decline, marking a difficult and unsettling phase for both the person experiencing these changes and their loved ones. Cognitive decline is not always immediately obvious. It can manifest gradually, with subtle signs that may be easy to overlook at first. However, as these signs become more apparent, they highlight the significant shifts occurring in the brain and the body's overall process of aging and decline. One of the most common and early indicators is memory loss. A person may begin to forget things more frequently, such as where they left personal items, or even important dates and events. They may also find it increasingly difficult to follow conversations, struggling to stay on track or participate meaningfully in discussions that they once engaged with easily. This can be particularly frustrating, as the individual may recognize that they are forgetting things, but not fully understand why or how it's happening. Their memory lapses might extend beyond names and dates. Sometimes, they may even forget where they are or become confused by familiar surroundings, like their own home or neighborhood. These cognitive lapses are not merely the result of normal aging, but rather a manifestation of decreased brain function due to diminished blood flow and oxygen supply. As circulation weakens in the final stages of life, the brain receives less nourishment, affecting its ability to function as it once did. The result is a progressive loss of cognitive abilities, including decision-making and memory recall. In more advanced stages, the person might even have difficulty recognizing loved ones or familiar faces. A heartbreaking and disorienting experience for both the individual and their family. Beyond memory loss, cognitive confusion can also involve problems with spatial awareness, time perception,
and reasoning.
The person may struggle to understand simple tasks or become easily frustrated with tasks that once seemed automatic. For example, a senior might forget how to do something they've done for years, such as how to use their phone or cook a meal, or they might become confused about the time of day, not knowing whether it's morning or night. In addition to these cognitive challenges, emotional withdrawal frequently accompanies the decline. As the brain struggles to process emotions in the same way it once did, seniors may experience a diminished capacity for emotional engagement. They might lose interest in socializing, avoid conversations, or even retreat into complete silence. This is not a reflection of their love or desire for connection, but rather a result of their brain's inability to process and respond to emotions as they did before. It can feel deeply painful to loved ones, as the person may seem distant, even though they are still physically present. In particular, loud or chaotic environments may become overwhelming for seniors nearing the end of life. Once active participants in family gatherings or community events, they may now shy away from these situations. What once was stimulating and joyful has now become taxing and confusing. In these moments, the individual may find solace in solitude, retreating into quiet spaces where they can find a sense of peace and security. This withdrawal isn't necessarily voluntary. Many seniors do not wish to be isolated, but the combination of cognitive decline and the overwhelming nature of their changing world often leads them to withdraw from social interactions. It is essential to recognize that this change is not driven by a lack of care or affection for others, but rather by the brain's diminished ability to process stimuli and emotions. Seniors may still feel love, joy, and connection, but expressing these emotions becomes more difficult, and they might no longer have the energy or mental clarity to engage as they once did. For families and caregivers, this emotional withdrawal is one of the most difficult aspects of the end-of-life process to accept. The person they once knew as vibrant and engaged now seems distant and unrecognizable. It can feel as though they are losing them before their physical body has even passed away. This can cause feelings of grief and confusion, as loved ones may not understand the reasons behind the withdrawal and may feel helpless in trying to reconnect with the person. However, it's important to understand that these changes are a natural part of the aging process and the body's final stages. While it is painful to witness, it is not a sign of a loss of love or connection, but rather an inevitable shift in the way the brain and body function. Families should avoid attempting to force the person to re-engage or to snap out of it, as this may only lead to increased frustration or agitation. Instead, the best approach is to meet the person where they are, gently and with patience. Providing a calm and familiar environment can be immensely helpful. Speak softly and clearly, offering reassurance and comfort. Familiar objects, music, and routines can provide a sense of stability and safety. While the person may no longer be able to express themselves in the same way, it is often in these quiet, comforting moments that the deepest connection can still be maintained. Creating a peaceful, safe space for the individual, where they're surrounded by things that bring them comfort and remind them of their life, can help them feel at ease in their final stages. Though they may be withdrawing from social engagement, the emotional bond remains, and small gestures of care, holding their hand, sitting quietly together, or simply offering a reassuring touch can still convey love and support. Families must remember that while cognitive decline and emotional withdrawal can feel isolating, they are an inevitable part of the aging process. This phase does not erase the connection that once existed, but instead marks the person's transition to a different way of being. Accepting and adapting to these changes with empathy and compassion can provide the best care and comfort in these final moments. 4. Frequent infections and slow healing. As the body weakens with age or illness, one of the most noticeable effects is a gradual decline in the immune system's ability to function optimally. The immune system, which serves as the body's primary defense mechanism against harmful pathogens such as viruses, bacteria, and fungi, becomes less effective over time. As a result, individuals may find themselves becoming more susceptible to infections that they would have easily warded off in the past. One of the most immediate signs of a weakened immune system is an increase in the frequency and severity of infections. A person who was once rarely sick may now find themselves catching every cold, flu, or minor illness that circulates in their environment. What used to be a mild cough or cold can now last much longer, and seemingly minor illnesses can turn into prolonged bouts of sickness. This is often because the body's immune response is slower or less robust, making it harder for the body to fight off infections as effectively as it once could. Infections, both common and more serious, may become a persistent problem. For instance, respiratory infections such as pneumonia or bronchitis can take hold more easily and may be harder to treat. The immune system's inability to respond quickly means that these infections may become more severe, require longer treatment, and may even result in complications. Similarly, urinary tract infections, UTIs, which are already common among the elderly, become more frequent as the immune defenses weaken. UTIs may not only take longer to resolve but could also lead to more frequent hospital visits and require stronger courses of antibiotics. Moreover, the body's ability to fight off skin infections diminishes as circulation slows. The skin, being the body's first line of defense against external pathogens, becomes more vulnerable when blood flow is compromised. This is often linked to the reduction in circulation efficiency, which in turn affects the delivery of oxygen and vital nutrients to the skin surface. Without these essential nutrients, the skin's ability to repair itself and fight off infections diminishes significantly. As infections become harder to manage, another complication arises: antibiotic resistance. In the past, antibiotics were a go-to solution for many bacterial infections. However, over time, the body may develop a tolerance to certain antibiotics, reducing their effectiveness. This means that the same medications that once worked well may no longer provide the same results. Consequently, treating infections can take longer, and medical professionals may need to prescribe stronger or broader-spectrum antibiotics, which come with their own risks, such as side effects or further resistance. Recovery from infections becomes a prolonged process as the body's natural healing mechanisms become slower and less efficient. Even the most straightforward infections that would typically resolve within a few days now linger for weeks, leaving individuals fatigued and more vulnerable to new infections during their recovery period. The cycle of frequent infections and slow recovery can lead to a significant decline in overall health and well-being, requiring careful monitoring and sometimes long-term treatment plans. Another critical aspect of immune decline and poor circulation is the healing of wounds. Small cuts, bruises, or abrasions that would normally heal without issue may now take an unusually long time to close. In some cases, these wounds might not heal at all, becoming chronic. This is because, without proper blood flow, essential healing elements like oxygen, white blood cells, and nutrients cannot reach the wounded area as efficiently as they should. As a result, the body struggles to repair damaged tissues, and healing is significantly delayed. One of the most concerning consequences of slow or improper healing is the development of pressure sores, especially in individuals who are immobile due to age, illness, or disability. Pressure sores, also known as bed sores, form when prolonged pressure on the skin restricts blood flow, leading to tissue damage. These sores are not only painful, but can also become infected, further complicating recovery. The lack of proper circulation and the body's weakened ability to combat infection make it difficult for these sores to heal on their own. Managing pressure sores requires vigilant care, including regular repositioning, wound cleaning, and sometimes the use of specialized dressings or treatments. In addition to these chronic issues, slow healing can also lead to a cycle of repeated infections in and around the affected area. For example, if a small wound becomes infected and does not heal properly, the body's weakened immune response may allow the infection to spread to surrounding tissues. This can lead to complications such as cellulitis, a common bacterial skin infection that may require hospitalization and stronger antibiotics. Ultimately, the combination of frequent infections, antibiotic resistance, and slow wound healing highlights the need for comprehensive care in individuals with weakened immune systems. It underscores the importance of early intervention, regular monitoring, and maintaining a healthy lifestyle that can support immune function. Additionally, medical professionals may need to adopt a more proactive approach, tailoring treatment plans to address these challenges and ensure the best possible outcomes for patients. In summary, the impact of frequent infections and slow healing is far-reaching, affecting both physical health and quality of life. With weakened immune defenses and poor circulation, infections become more prevalent and wounds take longer to heal. These challenges require diligent medical attention and care to manage, as the body's capacity to recover diminishes with age or illness. Without appropriate interventions, these issues can lead to serious health consequences, underscoring the need for ongoing support and vigilance.
5.
Major changes in breathing and circulation. A significant sign that the body is preparing for the final phase of life is a change in breathing patterns and circulation. You may notice that your loved one's breathing becomes slower, shallower, or irregular. Sometimes they might pause between breaths, or their breathing may fluctuate, speeding up and then slowing down. Another indicator is changes in circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. The skin may appear pale, bluish, or mottled, particularly around the extremities. This occurs because the body is redirecting blood flow to vital organs and away from the extremities as the heart becomes less effective at pumping blood. Shortness of breath may also become noticeable, even with minimal activity. They may experience difficulty breathing while sitting, talking, or moving, and may need to pause frequently to catch their breath. In some cases, fluid buildup in the lungs can make breathing even more difficult, leading to a persistent cough or gurgling sounds. For families, these signs can be alarming, but it's important to remember that they are part of the body's natural process of slowing down. The focus should shift from trying to fix the issue to ensuring comfort, keeping the room cool, offering small sips of water, or using a humidifier may help ease discomfort. Final thoughts. Recognizing the subtle signs that often appear months or even a year before a loved one passes away can be difficult but essential. Understanding these changes allows you to provide the best care possible, make important decisions ahead of time, and ensure that their final stage of life is filled with dignity and love. If you notice any of these signs, take a moment to reflect on how you can make your loved one's remaining time as comfortable and peaceful as possible. You are not alone in this journey. Many families walk this path, and while it's never easy, being prepared can bring clarity, strength, and peace. Thank you for joining us today. Please share your thoughts and experiences in the comments below, and don't forget to like, subscribe, and share this video. Your support helps us continue creating valuable content to inform and inspire.